A chronic kidney disease, CKD, is defined as the presence of moderate to severe levels of urinary albumin excretion and/or a rapid decrease in glomerular filtration rate, GFR. GFR, glomerular filtration rate, is the amount of blood that is filtered per minute and is measured in milliliters per minute. It is possible to estimate this rate using blood tests. Type 2 diabetes and hypertension are the two main causes of chronic kidney disease. In the case of obesity, the metabolic demands increase and force the nephrons to work at a greater capacity, which causes an increase in the size of the glomerulus to have more filtration area. It also suffers vasodilation of the afferent arteriole, which increases the pressure. Within the glomerular capillary, this entire process makes the nephron vulnerable to any damage it may suffer from a diet rich in red meat, animal fats, processed foods, animal proteins. The effects of high protein intake are more important in people who have a reduced number of nephrons because each nephron has to work at a greater capacity by increasing its glomerular capillary surface area and, in addition to afferent arterial vasodilation, causing high blood pressure in the capillary wall, scarring and loss of nephrons, as well as the death of cells that surround the outer layer of the glomerular capillary, which is the barrier to prevent proteins from escaping into the urinary space. This is how chronic kidney disease progresses. For patients with chronic kidney disease, it is recommended: reduce the intake of animal protein and egg yolk. Increase your intake of fruits, vegetables, and fiber. Studies have shown that very low protein diets reduce the risk of chronic kidney disease progression. But it is important to note that very low protein diets require essential amino acid supplementation and close monitoring to ensure adequate protein intake, calories, and macronutrients. It is also important to know that not all low protein diets are suitable for all patients. Care should be taken in elderly patients at risk of malnutrition, as a low protein diet increases the risk of protein energy loss, sarcopenia, and frailty, which negatively affects quality of life. The DASH diet, dietary approaches to stop hypertension, can be recommended as it uses protein from dairy plant sources and non-red meat. Salt refers to sodium chloride. We know of the deleterious effects of high sodium chloride intake on blood pressure, cardiovascular disease, kidney function, and the progression of chronic kidney disease. Reducing salt intake results in increased urinary albumin excretion. Existing chronic kidney disease nutritional guidelines recommend a sodium intake of less than 2.4 grams per day. Chronic kidney disease patients should be encouraged to prepare their own meals without added salt and to avoid processed foods. Increasing your intake of fruits, vegetables, and fiber can prevent or delay end-stage renal disease. High consumption of fruits, vegetables, and low-fat dairy products is associated with a 14% lower risk of chronic kidney disease. Diets high in fruits and vegetables and low in animal protein are associated with a lower endogenous acid load and therefore a lower workload for each individual nephron. As mentioned, increasing fiber intake can prevent the onset of kidney disease, as well as the risk of cardiovascular disease. However, currently there are no specific recommendations for dietary fiber intake levels for adults with chronic kidney disease, but it is known that fiber intake may be especially important for these people since it promotes the growth of bacteria that strengthen the gastrointestinal permeability barrier and facilitates the excretion of feces and helps promote the excretion of urea and potassium. The DASH diet, dietary approaches to stop hypertension, is characterized by its low consumption of red and processed meat, as well as high consumption of fruits, vegetables, and produce. Another component of the DASH diet that was significantly associated with lowering CKD risk was low-fat dairy products. The DASH diet is high in fruits and vegetables and low-fat dairy products and is low in animal protein. Consumption of a DASH diet is associated with 50% less net endogenous acid production compared to the typical Western diet. Although a modified DASH diet is recommended for patients with CKD, further studies are needed to determine the benefits and risks of vegetarian diets in this population.